I'm Dr. Shannon Turner. I'm very, very pleased to be with you today hosting the Public Health Association of BC Summer Institute 2025. Our focus on building well-being and well-being societies. We are a not-for-profit charitable organization that really focuses on a mission of equity, a mission of fairness, of bringing the best opportunities to populations in British Columbia. And of course, we partner with organizations and folks across the country on a variety of initiatives. And we never work alone. We always work in partnership. We have a variety of coalitions and networks that we participate in, and our focus is in leveraging each other's strengths and trying to find ways to build capacity within systems to strengthen population public health, environmental health, and planetary health. We're really concerned right now about the conditions in the world. And we believe that voices of reason and peace and well-being need to be centered. And so we've chosen this topic. And I think that this is an inaugural dialogue for us in British Columbia, but we also have national partners and international partners concerned with this effort. And we are hoping over the next year to really grow a discourse that leads ultimately to a foundational conference for us where we can collectively assert the conditions and the requirements and the actions needed to establish a comprehensive vision of a well-being society in Canada and hopefully support our partners globally in that effort as well. So we're very lucky today. We have an outstanding faculty that is leading this workshop from across the country. In fact, it's being co-chaired by Dr. Trevor Hancock and by Lindsay McLaren. I'm going to introduce them to you more deeply in a moment, but I want to begin by saying that I'm coming to you from the traditional territory of the Lekwungen, the Songhees and Esquimalt First Nations. I am so grateful to live and work on this island, to be part of British Columbia, to be part of Canada. I really appreciate the work that's being done to address racism and inequity, to focus and foster reconciliation, for PHABC to serve as an ally in strengthening both protection of our planet, our First Mother, but also our Indigenous relations here. We are blessed this morning to have Sandra Martin Harris, soon to be Dr. Sandra Martin Harris, joining us. Sandra is going to provide us with a territorial acknowledgement and welcome. Sandra is a Wiestes Sandra Martin Harris. She is a PhD candidate at UNBC. She is a sister and ally in terms of our work on sustainability, planetary health, and well-being. She's the perfect person to center and ground our dialogue today. We've been so blessed to partner with her on a number of focus areas, in particular on supporting the public health workforce to more deeply understand land-based learning, Indigenous ways of knowing, and grounding our respect and work on climate science and planetary health in a love of nature, in a deep connection to nature. So Sandra's the right person for us this morning, and we're very grateful to her for being willing to open. So Sandra, if I can turn it to you, please. And thank you once again for taking the time to be with us in this important discourse.
Tabe Masai and Bin Hansu for those kind words. Good morning. I'm calling in from Port McNeill. Just got off the long ferry ride last night from Prince Rupert to here, and just loving the slowing down aspect of traveling by water and on the water. I just thoroughly enjoyed no technology, just the trees and the coast and the quiet. And I believe I'm calling in from, I'm going to say it wrong, Quaqua territory here in North Island, Vancouver Island. And it's a cool, thank you, Miss I knew I was going to say that wrong. I don't get to this territory very often, so it feels like a real honor and a privilege to be here. I'm watching the boats come out of the harbor here, and it's just a lovely, lovely morning. Just want to recognize, the 33 or so different Indigenous nations speakers, languages here in so-called BC, and how our language helps center us as a people, connects us to place, teaches us of respect and love and care. And I love that idea of centering, Shannon, that you mentioned, and the need for centering, how important centering is. When we have so much turmoil or trouble, coming back to that calm place, like the calm waters, the calm harbor, calm winds, and to remember our teachings of life cycle, the teachings of cycle that we're in, and helps ground us, helps us have the ability to look forward, helps us grow and heal, and take care of each other in a good way when we're in that centered place. And so that's a powerful teaching. And I'm excited to see this conference happening. Well-being is near and dear to my heart as we look to take care of our children, our youth, our men, our women, and our elders. Well-being is center and connection back to land and water are more than human beings that provide for us every moment of the day through healthy water, healthy air, hopefully good fish, healthy moose, healthy plants. I was out harvesting this weekend and it was so beautiful, but I was quite alarmed at how dry and crunchy the ground is. And seeing the different plants come up in drought is so interesting to me. And so just noticing that cycle that we're in. And so I'll be with you on and off the day as I make my way down to Nanaimo today, and I'll see you later at 11. But I wish you well in the morning sessions, and so excited to see the speakers and presenters that are coming today. You're going to have an amazing day.
Thank you so much, Sandra. Thank you for bringing us into the season and connecting us to this place, the places that we are, to think about the physical space that we take up as human beings and how we connect with each other and with nature. And what are those cycles of learning and the cycles of nature and the cycles of opportunity and the cycles of decay, all of the things that impact us as we try to network and work together to respond and to plan for better outcomes. So I'm appreciating how you always broaden our consciousness in the way that you greet us. And I thank you for that, because we hope today's dialogue will be broad indeed, and that it will really inspire us into new directions and new thinking about an area we're seeking to understand more fully. So thank you so much, Sandra, and we'll see you throughout the day. And now it's my privilege to introduce our two scientific co-chairs, both of whom need little introduction if you've been working in public health, planetary health, well-being, economies. But I want to take the time to share with you a little bit about what they've accomplished and what they bring to the table, because I think that it's important to acknowledge the interconnections that happen when we work collectively. And both Lindsay and Trevor are a story of interconnections and of networks. And both of them bring a profound appreciation for systems and systems thinking. And that is essential when you're considering well-being society. So let me begin with Dr. Lindsay McLaren. And Lindsay's a professor in the Department of Community Health Sciences at the University of Calgary, where her scholarship and teaching focuses on the social determinants and political economy of health. And again, this is an area that many of us have an interest in terms of what healthy public policy impacts the way that we move forward, what regulation and legislation impacts the way that we shape social opportunity and infrastructure. And Lindsay's research, she had an applied public health chair and received the CIHR IPPH Trailblazer Award, which is a career achievement award that recognizes exceptional contributions in population and public health research. Lindsay's past president of the Alberta Public Health Association and currently serves as senior editor for the Canadian Journal of Public Health. She also serves as co-editor-in-chief for the Journal of Critical Public Health, which is a community nonprofit journal formed following a mass editorial board resignation from corporate publishers. Of course, we're very interested in that story, Lindsay, from the commercial determinants of health perspective, but we'll leave that, and we thank you for your service. We have often partnered with Alberta Public Health Association on farm-to-school projects, on various different initiatives, and we see this opportunity to strengthen the Western region with respect to this discussion and potential social action. And then I'd like to introduce to you one of my oldest friends, Dr. Trevor Hancock, who is the ancestor of the Healthy Cities movement, is the author of numerous literature reviews, evidence, and policy papers, coined the term healthy public policy, if you will. Trevor has been a long-standing ally and excellent advocate for public health infrastructure, for healthy public policy, for environmental stewardship, for planetary health, for commercial determinants of health, looking at how industry impacts our social conditions, programs like the Ottawa Charter, the influence of documents like the Ottawa Charter. Trevor brings all of that insight, wisdom, and passion, and he is retired apparently, but he works harder than anybody I know. Yeah, in small quotes. He's partnered with most of you on this call on one thing or another, I see. In particular, Trevor is a person who never forgets the implications of our actions, who is unafraid to speak truth in the most senior rooms that exist globally, and who has borne, I think, an extraordinary level of service that I don't think very many people could have done what Trevor's done consistently for so many years. So here we are still working with him, still grateful to him. And I think he and Lindsay have helped to shape a deeply participatory day that you are all going to enjoy. And I just wanted to take a few minutes to recognize their excellence, their leadership, their service, their capacity, and their willingness to be part of an ongoing discussion that makes a difference to generations to come. And I say that with a deep sense of appreciation. So to you both, thank you. So what's next on our agenda?
So thank you for those really kind words. All you missed out there was that I'm a Morris dancer and a green man, and that's what keeps me sane through all of that. So I'm going to just let Lindsay say a few words of self-introduction, and then I'll pick it up and do the introduction to the program overview. So Lindsay, anything you want to say?
Great. Well, hello, everyone. Thank you so much, Shannon. And thanks to Sandra for that wonderful opening welcome. So I'm Lindsay McLaren, as was just said, and I'm really delighted to be the co-chair of this year's PHABC Summer Institute and to have had the chance to work with Trevor and the amazing PHABC team. I'm joining today from Calgary, Alberta, which is the traditional territories of the peoples of Treaty 7, including the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda, as well as the home of the Métis Nation of Alberta Districts 5 and 6. And I really just wanted to extend a warm welcome to everyone joining today. And I look forward to interacting with you over the course of the day. And I'll hand it over now to Trevor to set the stage for our day together.
Thank you. And likewise, I'm joining, as is Shannon, from the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, of their unceded territory here. And it's a privilege and honor to be here. And I am particularly grateful for living just north of the Gorge, which is a beautiful part of Victoria. So let me move into some introduction here, and in doing so, I also want to acknowledge, as Lindsay just did, the work in particular of Kelsey and the whole team at PHABC in putting this together. It has been a wonderful experience, and I think you're going to have I'm quite excited about the day we're about to have. So I'm going to spend a few minutes just providing some overview to this. Here's some context. This is a quote that's actually 2 years old. A little over 2 years old now, from Antonio Guterres, the UN Secretary General, in talk briefing the General Assembly, UN General Assembly, back in February of 2023. He talks about this confluence of challenges unlike any other in our lifetimes, and he refers to war and the climate crisis and the extremities of poverty and wealth, and the gulf between haves and have-nots, and so on. All of those things, I would say, in the 2 years since then have actually gotten worse. So there's a sort of global context for what we are facing. And recently, PHABC, and I want to here acknowledge the particular leadership of Shannon, who I usually refer to her as dynamite or a dynamo. Dynamite might be a little too explosive. But under her leadership and the PHABC board, we've addressed a number of those challenges just in the last few years in our conferences. The one in 2022 on Our Planet, Our Health. We talked about the digital age in 2023. Last year, we looked at the commercial determinants of health, and now we're looking at building well-being societies, which is the response to some of those challenges. And the way we're seeing this is that this is the first part of a PHABC initiative that provisionally we're calling Transforming Society for Wellbeing in the 21st Century. So we're starting with this day-long summer institute, which is to really introduce and explore the topic and the issues. We're planning, starting in the fall, to do a series of monthly webinars. And one of the things I'm hoping we'll get out of today's events is a sense of areas where we need a more in-depth exploration and discussion of issues. And that will inform the topics for the monthly webinars. All of that leading up to an annual conference sometime in 2026, we hope, to be decided, that will really dig into this in a major way. And I also think we haven't got it on here, but I think we're going to need some policy and papers and things like that about how do you make a well-being society. And then we want to expand that work, and we want to expand it, first of all, beyond the Public Health Association of BC to the rest of the health sector in BC. I'll come in a minute or later on to the Canadian Coalition for Planetary Health and a Wellbeing Society, of which I'm an interim convener, but we might need the equivalent of that in BC. And actually, just a couple of days ago, I was talking with Angela Wignall, who is the Executive Director of the Nurses and Nurse Practitioners of BC, some 77,000 of them. And she was quite excited, talking to her about joining the Canadian Coalition, but she's very interested in the idea of a BC coalition and working with PHABC on that. And then we want to expand this thinking beyond the health sector, because very clearly, and as the day will make clear, if you're not already clear, the creation of a well-being society goes well beyond the health sector. And in fact, the first international conference I ever organized was more than 40 years ago now, and it was called Beyond Healthcare. And that was where we launched both healthy public policy, and it turned out we launched healthy cities. So these are not exactly new ideas, but they do easily get lost, and we need to keep going back to that. And then just an idea that I've been kicking around recently. If you're as old as me, you will remember, and I know not many of you are, you will remember the People's Commission on Food, People's Food Commission, that traveled across the country in the late 70s, looking at food policy and food systems. And so the idea would be, can we do something a bit like that, but tuned to the 21st century, to create a commission for a wellbeing society that could travel physically and virtually across the country, creating conversation about that. And then we want to link it to all sorts of national and international work that is already underway on wellbeing societies and on wellbeing economies. So this is big work we want to undertake, and this is the beginning of that big work. I also think if we're talking about big work, it's worth reminding ourselves of that wonderful adage that we need to think globally but act locally. So taking all of these ideas back into community, back into our neighborhoods, back into our own homes. A sort of theme that Lindsay and I batted back and forth and came up with this. Some of you will know Rudolf Virchow's famous comment in 1848 that medicine is a social science and politics but medicine writ large. Now, that was 180 or so years ago. We've got a modern version of it up here, that public health is a social science and politics, or more broadly how we organize our society, is but public health writ large. And it is that understanding that underpins everything we're doing today and everything we hope to do through this PHABC initiative. Really comes down to this: what if society were organized in a way that puts the well-being of all people and of the planet at the center? That's not how we currently organize society. What we put at the center mostly is the economy, as you'll have seen with the recent focus of the federal government and the provincial governments. But what we want are what WHO in its Geneva Charter for Wellbeing a couple of years ago now called wellbeing societies. And they are societies that are, quote, committed to achieving equitable health now, equitable being a very important word there, equitable health now and for future generations, another really important idea, without breaching ecological limits. So it ties together the issues of social justice, intergenerational justice, planetary health, planetary boundaries, all of that. And how do you have a society that achieves that? That's what a wellbeing society is. That's what, in one way or another, our discussions today and into the future will be focusing on. So with that, I'm going to turn it over to Lindsay, who will give us an overview of the program. but will also set us up for the small group discussions. So one of the things we're doing today it's a very participatory day with three lengthy opportunities for small group discussion and participation. And we're going to plunge you straight into it in a few minutes. So Lindsay, shall I just leave this slide up and I can click them forward for you?
Yes, please. Thanks. Thanks very much, Trevor. I am pleased to run through the program schedule for the day. So we'll shortly send you into small groups where we will invite you to reflect on the concept of well-being. And I'll return to this in a second. We'll then have a 20-minute break and welcome you back for a 10:20 a.m. plenary session on Introduction to a Wellbeing Society. That plenary session is intended to set the stage for the next small group activity at 11, where we'll invite you to discuss the implications of a well-being society around different themes with the support of expert facilitators. We'll have a lunch break from noon till 1, and then the afternoon is intended to help make the well-being society concept even a bit more tangible. We'll gather for a plenary from 1 till 1:20, which draws connections to public health practice, and that will set the stage for our final interactive activity, which is a World Cafe exercise where you'll have opportunity to virtually circulate through 4 different topics or policy areas with expert facilitators to explore your role in this space as a public health practitioner and as a citizen, including what some next steps could be. So we'll explain the activities again when we get to them, but this gives you a sense of the whole day. Finally, we'll close the day with a brief opportunity to share any aha moments that you might have with the full group, as well as some closing remarks from Trevor and I. So with that, Trevor, if you wouldn't mind flipping ahead, thank you. I'll just introduce our 9 a.m. small group activity. This will be a self-directed and group moderated activity, although you may see PHABC staff as well as Trevor and myself pop in and out. We'll suggest that you begin with a round of introductions in your group, and then firstly spend a few minutes on your own reflecting on what well-being means for you on a personal level. Please jot down your thoughts and put them into Mentimeter number 1. Once you've had a chance to do that, you can share and discuss that with your small group. Then we'll invite you to do the same thing, but extending the concept of well-being to a community level. What does community well-being mean to you? Please add your thoughts on that to Mentimeter number 2. And once again, once you've all had a chance to do that, please share and discuss with your group. There will not be a report back phase for this activity. Our idea is to capture your ideas and discussion via the Mentimeters. So with that, I'll hand it over to Christina to explain further and then put you into rooms and to take any questions if needed. Thanks, Christina.
No problem. Good morning, everyone. So just in a moment, we will be opening the breakout rooms. You will be directed into one of your small groups where you will be given a chance to introduce yourselves to everyone else. And then the facilitators in the room will share the questions and share the links to the Mentimeter in the chat. Once we open it, if you have any trouble getting into a breakout room, please just speak up and we will manually place you into one. And if you have any trouble in the breakout room, we do have a PHABC staff member that will be helping facilitate. They will introduce themselves in the room, and if you have any trouble, feel free to reach out to them. Does anybody have any questions right now, or should we just get started? I'm seeing no questions, so we will open the breakout rooms now. And once again, if you have any trouble getting into it, just let us know and we'll help you out. Welcome back, everyone. I hope question 2 went just as well as question 1. I'm just going to really quickly share my screen so we can see the beautiful word cloud that's been made for question 2. And there we are. Safety, equity, connection, inclusion, collaboration, belonging were some of the comments that were the most left the most often. So this is once again another wonderful, wonderful word cloud. Anybody want to share any quick aha moments before we go into the break?
Christina, I wouldn't mind sharing from our group. I think we had a really interesting mix of folks. We had individuals who were working at the individual level around well-being, and at Aranke, if I may, mentioned 9 sort of dimensions of well-being that they use in their work. And then we had Lynn, who's actually doing a session later this afternoon on governance, who also talked about right relationships. And in the notion of right relationships, we could see the dimensions that Adoranke raised. And then anyway, I think that there's opportunities for us to do some mapping around the approaches that people are applying to this inquiry so that we can build a little bit of a mind map around how different research lenses are being applied or theoretical models. The notion of right relationship, of course, is foundational to social ecological models of health. We are in relation to the environment, we are in relation to each other. And then Bushra mentioned to us the notion of a deep alignment between spirit, mind, and body. And when your mind is in harmony with your heart, and when you have the agency to undertake the kinds of things you want to do within your environment that you know are good for you and right for you, and how that freedom to do that is essential to your experience of well-being. And you have to have the conditions in your community that enable you to do that. So it was a wonderful conversation. And I'm sure you all had great conversations in your rooms too. So there might be others that want to share, but I see some richness here already, deeply rich discourse around perceptions of well-being at the individual level, ways of understanding well-being in terms of infrastructure, in terms of governance, in terms of civil society and democracy, in terms of principles like equity and inclusion and diversity. So yeah, rich, rich, rich. And we've only just begun. So it's going to be lots of fun today. Thanks.
We have. Awesome. And yeah, I will note that we will be sharing both of these word clouds as well as other resources after the Summer Institute is over. I've got a link to Adoranke's 9 Dimensions of Wellness as well. So we'll be sharing that too. And if you guys have any other resources that you want to share around, feel free to put them in the chat and we will collect them to share at the end of the day. Yeah, and we're collecting all the information. We'll have a nice fulsome report and I'll pass it back to Trevor.
Well,
I see Douglas.
We've got Doug has his hand up. Hi, Doug. How are you?
Good, thanks, Trevor. Nice to see you. Didn't make the word cloud, I don't think, unless it's in fine print, but we had a good conversation in our second room that a proxy measure for the well-being of a community is the number of dog parks. And there was lots of interesting conversation about the value of pets and community connection.
Yeah, our non-human relations. Thanks, Doug. And I also thought about Sylvia Robinson and I many years ago were looking at indicators of healthy community. And one of the things we thought was really important was access to bookshops and coffee, as well as laundromats for people to get their clothes clean. And those are some of the funny little ways that people engaged around community and met on the streets and had that experience of human connection. Okay, so where are we at?
Okay, well, we're at a break. Two things. I'll just share very quickly. I shared it with my small group on that point about what people think a healthy community is. Back in the 1980s, when we were first exploring the idea of healthy cities with the Department of Public Health in Toronto, we did workshops and we asked public health staff what was their experience of a healthy city, what when they thought back made them think, oh, that was a healthy city. And a public health inspector gave the best answer I think I ever heard. He said, well, I got up this morning and I flushed my toilet and it worked. So we shouldn't forget the real basics. The other thing is think about for the rest of the day, what would it mean to create a society or a community that reflected the values that are in those two Mentimeter diagrams, those two wordles. So that really kind of informs our thinking about, okay, what would a society look like based on that? And with that, we will take a break. 20 minutes, and we'll see you back here at 10:20 PST. Thank you. Okay, welcome back, everybody. We currently have 84 people in the room, apparently. So this next session isn't me. It's actually Lindsay. So I'm going to turn it over to Lindsay, and she's going to talk about the Wellbeing Society.
Great. Thank you, Trevor. Okay, hi everyone. Welcome back. I'll get right into our plenary session here. But I just quickly wanted to say that I hope that first interactive session served to get the juices flowing, so to speak. And I'm also hopeful that that activity prompted a glimpse of how different and potentially way better our world could be if well-being were at the center, which is the basic idea of a well-being society. And I certainly I certainly felt that way based on the group that I was part of. So thanks for that. So this plenary is focused on a well-being society, and I have a couple of objectives for today. The first is for us to be able to describe what is meant by a well-being society. And I just want to flag early on that this idea is complex and layered. It's one of several concepts in public health, with other examples being the social determinants of health or health equity, for which it maybe feels pretty easy to engage on a superficial level, but doing so is potentially missing the point of the idea and potentially doing harm by entrenching harmful societal structures. So for that reason, while a well-being society offers an appealing vision, it also requires asking some hard questions about ourselves and our field. And so this is just an invitation to be open to that. The second objective is to identify how or why a well-being society is important for public health. And I think this provides a prompt and an opportunity to reflect on some of the contours of our field and to connect the dots. And I believe that there are many dots to be connected in this space. So to get us started, the World Health Organization defines a well-being society as societies that are committed to achieving equitable health now and for future generations without breaching ecological limits. So this is a great place to start. It's from the WHO Geneva Charter on Well-being. And when I say World Health Organization charters, I suspect that at least some of you are maybe thinking of the Ottawa Charter for Health Promotion of 1986. And indeed, the Geneva Charter for Well-being builds on that long-standing health promotion tradition and legacy. So there's already a signal of an important connection to our field. To make this a little bit more tangible, here is a visual framework that you may have seen. This is one that I find quite helpful. So this is the donut economy developed by British progressive economist Kate Raworth. As you can see, the inner ring of the donut represents the social foundations that everyone needs to be well. For example, housing, food, political voice, ability to participate in society with dignity, etc. And the outer ring of the donut represents the ecological limits, both local and global, that we must not exceed if we envision an equitable future. So this actually gives a lovely way to think about well-being as the safe and just space for humanity. Part of why I like this framework is because in my mind, this is exactly the social and ecological determinants of health. And it brings those two things together in a way that feels compelling and rather obvious. Another appealing thing about this framework is that it can be adapted for use by an entity like a government or a workplace. So using this as a framework, one could set up ways to identify areas of shortfall in terms of social foundations, or areas where not everyone has the social foundations needed to live and to thrive, and overshoot in terms of ecological limits, where we are exceeding those ecological limits, and design policy in a way that tries to address those problems. And indeed, the city of Nanaimo in British Columbia has adopted the donut framework as their city vision. And indeed, there may be people in this group today who are from there and can speak to it better than I. Okay, so beginning to unpack that a bit, here is what the Geneva Charter identifies as the foundations of well-being. This is perhaps a good place for me to disclose that I actually don't love the Geneva Charter. I think it's okay. I like parts of it, but we can use it as a frame. So the Geneva Charter identifies five foundations of well-being. Firstly, a positive and multifaceted vision of health. Secondly, principles of social and environmental justice and equity. Thirdly, so the original wording of the Charter is commitment to sustainable low-carbon development, grounded in reciprocity and respect among humans and making peace with nature. So I have been cheeky and crossed some of this out because it uses the sustainable development language, which is not unproblematic. So sustainable development often implies, or at least it is vague about, how it relates to the economic growth paradigm. And this is a problem because a well-being society requires engaging with degrowth or post-growth paradigms. So having it in there is an assumption that needs to be worked through rather than taken for granted. And so this is an example of one of the hard questions that I mentioned that we need to be open to engaging with. The fourth foundation, according to the Charter, is new indicators of economic and societal success beyond GDP, gross domestic product. And fifth, a focus on empowerment, inclusivity, and meaningful participation. So hopefully you're already kind of detecting some important connections to our field. So for example, the first one is very consistent with how we have long defined health, including the definition in the WHO Constitution, where health is about physical, mental, and social well-being, and not only the absence of physical sickness. And the Ottawa Charter for Health Promotion, which described health as a resource for living. Secondly, principles of social and environmental justice and equity is, of course, very consistent with milestone efforts and documents in our field, including the World Health Organization Commission on Social Determinants of Health of 2008, and the Canadian Public Health Association work led by Trevor Hancock and others on addressing the ecological determinants of health. Thirdly, if we take a bit of a stand here and we get rid of the sustainable development language while we sort out where we sit on it, then this foundation around reciprocity and respect and making peace with nature, I would say, is quite consistent with the work of the excellent work of the COPE Canada group, the Community of Practice in Ecosystem Approaches to Health, which I had the great pleasure of being a small part of just last month. Fourthly, new indicators of success beyond GDP. This one is perhaps a bit of a stretch because in public health, we don't spend much time in this space, although we should. But it strikes me as potentially aligning with the core public health function around population health assessment. We have some skills and ideas that are relevant here. And then finally, the focus on empowerment, inclusivity, and meaningful participation, I think are very well aligned with core tenets of health promotion going back to the Ottawa Charter. The Geneva Charter for Wellbeing goes on to argue that creating well-being societies requires coordinated action in several areas. The Charter identified 5, and then our team here amended and added to this list. These are briefly discussed in the think tank piece that was circulated, and these 8 areas will be the focus of the 11 a.m. session. So you'll be spending an hour in a small group discussing one of these 8. And so I'll just kind of list them here. So firstly, value, respect, and nurture planet Earth and its ecosystems. So this is speaking to a healthy planet as an essential element of a holistic vision of well-being, including for future generations. Secondly, designing an equitable economy that serves human needs within ecological boundaries. I'll just flag that our current economic system does neither. In fact, it fails spectacularly at both. So that needs to be something we talk about. Thirdly, develop healthy public policy for the common good, speaking to the need for a whole of government approach, which is consistent with work on intersectoral approaches, such as health in all policies. Fourthly, foregrounding the core concept of equity and expanding it to include intergenerational and interspecies equity. Fifthly, center Indigenous ways and values, which in many ways are already deeply in this space of well-being. Sixth, consider governance for health and well-being, where governance broadly refers to how individuals and institutions plan and manage activities. Seventh, consider the role of the health sector, which presently is overwhelmingly focused on medical care within all of this. And then finally, to address the specific impacts of digital transformation, or how digital technologies are substantively reshaping how we do things in most aspects of our lives. I mentioned earlier that the Wellbeing Society idea offers inspiration, but it also requires asking hard questions. In terms of inspiration, these are a few thoughts. The Wellbeing Society offers a coherent vision for turbulent times. It very much embodies upstream thinking. And indeed, the whole point is that rather than fixing or cleaning up problems after they have occurred, to provide the conditions for all people and our planet to be well in the first place by default. A well-being society is equity-centered and public-driven, both of which are things that many of us care deeply about. Because of these elements, there is potential for broad appeal, meaning potential for many people to see themselves in such a vision. And this is key because broad civil society engagement and activism is essential to any transformative social change, which is what we're talking about if we are in the well-being society space. So what about the hard questions? Well, it's important, first of all, not to understate how different this is from the status quo. This is not an incremental shift or a tweaking of things at the margins. And no matter where you sit on this discussion, I would invite you to have respect for that. Engaging with the idea of a well-being society requires naming and engaging with structures of power, because there are some who benefit from the status quo and who will therefore resist change. This can be obvious, but far more often it's very subtle. And we need to hone our skills to be able to uncover it. A heuristic that I find helpful for this is looking out and looking in. Looking out is about keeping our gaze focused on those upstream or structural drivers of health problems, and especially health inequities, and identifying when well-being is being depoliticized. This happens frequently, and it's not innocuous. One example is where well-being is reduced to being nice to one another. That is important. I agree that we should be nice to one another. We should be decent people. But that is not a substitute for robust, inclusive, and equitable policy, institutions, and services. Well-being can and has been used to distract from the fact that public institutions and services are being cut. Looking in is about reflecting inward with humility at ourselves and at our field for the ways in which we might be obstructing the kinds of shifts that are required. And this is hard because it requires surfacing assumptions that we may not realize we even have, and this can be uncomfortable. So a quick example of looking in, this is a recent paper that I worked on with my colleague Eric Mikolovsky, and it was a historical analysis of our National Public Health Journal, the Canadian Journal of Public Health. Based on recognition that our economic system and its ideological underpinnings are incredibly important for human and planetary health. And this could be good or bad. It happens to be really bad right now. So it's very important, but we don't do a great job of engaging with this in public health. And so Eric and I looked historically for insights into this phenomenon. In brief, we observed some strong but seemingly subconscious patterns. For one thing, when authors engaged with the economy or economics, it was in a way that upheld the capitalist vision. For example, in the 1940s, there was quite a bit of interest in milk, including consumption, package labeling, pasteurization, etc. And in that context, the tone was, for example, celebrating that compulsory pasteurization in Ontario did not hurt the dairy industry. So this conveys a goal of trying to find win-win arrangements with industry when in fact industry and public health under capitalism are at odds. A second key finding was that even though Canadian Journal of Public Health authors have long been concerned with socioeconomic inequalities in health, those inequalities are consistently divorced from their political economic roots. That orientation serves to treat structures as fixed, which makes it even harder to engage with alternatives, which is what a well-being society entails. So I can imagine that some of you are listening and thinking, or maybe some of you have stopped listening because you're so irritated with me, but maybe some of you are listening and thinking, well, pragmatically, we had to do that. And and I've heard this many times before, but this is a prime example of a hard question that we need to grapple with. If we want to be part of a shift towards a well-being society, we need to carve out space to start talking through some of these very significant tensions in our field. So to that end, I'll just kind of start to close here with a few more thoughts and remarks around the connection between a well-being society and public health. So a common and long-standing definition of public health is something along the lines of the art and science of preventing disease and promoting health through organized efforts of society. This definition conveys a few key features that are worth pulling out. Art and science reminds us that it's not just epidemiology, It's also social science and politics. Organized efforts of society, I continue to think of just a lovely way to remind us that we need to think beyond the health sector. And preventing and promoting points to what I believe is our shared focus on keeping people healthy in the first place. A well-being society prompts us to reflect on the words in our name, both public and health. I've already touched briefly on health, pointing out how the Wellbeing Society is very aligned with a holistic and multifaceted vision of health that is not just about physical sickness or its absence. So this is consistent with how we talk about it in public health and have done so for a long time. But what about the word public? And how often do you think about that word? Here are a few of my thoughts. So the public, on the one hand, perhaps signals our focus on populations, which distinguishes us from clinical medicine, for example. A focus on the public also means that we are not, or we shouldn't be, just about technical expertise, the element of engaging with publics. The word public also makes me think of everyone, the general public, for example, which for me raises the issue of equity and recognizing that not everyone starts at the same place. Finally, the word public, importantly, brings to mind public sector. In our society, how do we provide the goods and services that we need to live and to thrive? Do we provide them publicly, which signals the public interest, or do we provide them privately, which serves to commodify people and entrench dynamics of power? So the public is about people, power, and politics, and this is why public health is or must be a social science, as per our adapted version of Virchow's quote that Trevor mentioned earlier today. So this is not uncomplicated because public health is not just one thing. We can think of at least two versions. On the one hand, we can think of a narrower version, which includes the subset of programs, services, legislation, etc., often situated within the government health sector that is nominally at least focused on populations. So this would include core activities around prevention, health promotion, health protection, etc. On the other hand, we can think of public health as the public's health, including all of the factors that shape well-being and its distribution in populations, and the sectors and communities that go along with that. Significantly, these do not always coexist peacefully. Rather, there can be very significant tensions between them simply because what would be required to support and improve the public's health is heavily constrained by the institutions that shape the narrower version of public health, which is often the face of our field. These tensions are significant, and in a context where we are all fundamentally competing for things like funding, credibility, and impact, they can serve to divide our field, which limits our ability to mobilize as a collective around the public's health. So it's imperative that those of us with different roles and perspectives in public health find ways to come together, which is just one reason why I'm so pleased to be part of this event today. So in conclusion, I believe and would argue that public health communities are or could be strong allies with this important movement towards a well-being society. And indeed, the well-being society frame offers us a way to work towards our stated goals of population well-being and health equity, keeping people healthy in the first place. This will require hard work, including within our field, in the form of both looking out and looking in. And I personally look forward to trying to figure this out together. Thank you.
Thank you, Lindsay. And that was an interesting, thought-provoking point. I particularly like the distinction between the narrow and broad understandings of public health. And if you look back over time, we were part of a group, a decade or so ago, that responded to, actually it was more than a decade ago, 15 or 20 years ago now, responded to a push on public health in the time of the Stephen Harper government that wanted public health to quote unquote stay in its lane being infectious diseases, and not talk about the economy, not talk about equity, not talk about industrial policy and things like that were quote unquote, none of our business. And actually, you can see the same thing occurring now. We've had pushback here in BC from a couple of places about planetary health. Why are health authorities looking at planetary health when clearly what we need is more clinical care? And why are we wasting money on these sort of big ideas that have nothing to do with public health? And of course, we're not taking that lying down. We're pushing back in various ways. But it is an ongoing debate, and it's been a debate for as long as there's been public health. I often refer back to in some ways, the birth of public health back in the city-states of Renaissance Italy. And they had the same conflicts going on between merchants and health officers 600 years ago that we have to this day. So there's nothing new in this, but we need to keep pushing. So thank you for that. We do have a bit of time for some comments or questions if anybody would like to, building on both what Lindsay has presented here and on the earlier discussions in your small groups. So if you want to say anything, please use the hand button, which is under the React icon at the bottom of your page, and put your hand up. And Shannon, go ahead.
Hi, thanks. I just wondered if we wanted to check in with Val and Claire on this, what Lindsay had to share in terms of systems and large-scale systems and the Geneva Charter and their roles in the collaborating centers related to this work before we get into our next session. So I don't want to put you on the spot, but I'm sure that everyone would really appreciate your insights in the plenary here versus in the small groups. So I don't know if that's of interest, Claire. Maybe we could start with you.
Well, we've got Simon with his hand up, so let's start there, and then we'll go to Claire if she wants to respond.
Hi, Trevor. Thanks. And thanks, Lindsay, for what a lovely, concise summary and some really provocative points. I do have to skip out for a little bit between 11 and 1, so I just wanted to sort of say a couple of things. This is something that has been part of public health's dilemma from the very beginnings. I always like to start courses on health promotion or public health, starting with Engels' Conditions of the Working Class in England, 1845, where it's made very clear that what we're talking about here is, as Engels famously put it, social murder. This is organized systems knowingly putting people in positions where they're going to suffer early morbidity and mortality and have terrible lives. And that way of thinking about public health as a bottom-up grassroots democratic rejection of that system is something that's part of our lifeblood. And to be honest, I've always seen Trevor as a person who comes from the tradition not of the sort of centralized public health officer telling people what to do and when to do it, but rather as the famous public health doctors of Manchester that put together the data of what was happening to people living in poverty. And I think that we need to reconnect and hold on to that tradition very hard. And that means we can't but look to that broader vision of public health. And we need it more than ever. So I just wanted to sort of say this is timely, positive vision. I always love the famous Italian Marxist Antonio Gramsci's phrase, which is pessimism of the intellect, optimism of the will. We have to be realistic. And I think Lindsay's right, real questions to address, real tensions and struggles, real illusions and delusions. But we also have a lot of ability to see positive things change in our communities and with some of the people on this call. So that's my 2 cents for now, and I'm really looking forward to talking to people about local democracy in the afternoon.
Thanks, Simon. And we might add to Gramsci, hope of the heart. Claire.
Yeah, I'm going to give...
Maybe not everybody knows, incidentally, either who Simon is or who Claire is. So, because we have people from across the country. So, Simon, just very briefly.
Sorry, Trevor. I'm a adjunct professor of sociology and in the School of Public Health and Social Policy at the University of Victoria. I've been writing and researching really around the sociology and social theory relationship to health promotion and public health for a couple of decades, and I've been collaborating with the Public Health Association of BC for a long time, and happily so. Thanks, Trevor.
Thank you. Claire.
Hi, so Claire Betker here, and I'm in Treaty 1 territory. That's where I live and work, the homeland of the Métis Nation. I'm a registered nurse, and somebody named you as a doctor, a physician at Trevor. So that center of nursing, and I was a public health nurse for many years. And so that informs, and it's going to inform my answer as well. 3 points, and they're kind of a bit aligned, but not aligned. This is an opportunity, and Lindsay, beautiful, beautiful presentation. I love, it was elegant, actually. It would be the word that I would use to describe it. And it's a call to action. And as a public health practitioner, I hear that call to action. And I think we should pick up that call as a collective in the public health community, in collaboration, in partnership, in relationship with all of the other folks out there. But if we do, we have to be prepared that it's not going to be easy, and we can't give up the fight along the way. Like, it's sustained effort. Trevor, you're a beautiful example of that sustained, dogged effort. So it is an opportunity, but if we pick it up, be prepared that it's not going to be an easy or quick or way forward. But I have that optimism of the heart and the mind and the soul. We just did the core competencies consultation engagement across the country. We spoke to, in a real and meaningful way, more than I think 3,000 of the public health community that I think probably only numbers about 40,000 across the country. And they're up for this. They are up for the collective effort required to build a well-being society, to really enact what you have defined public health as, Lindsay, and what you've challenged us. So I think it's out there, but many of them sit in systems where that isn't the dominant value. It isn't the dominant metric. It isn't the dominant ideology. Never mind societies and communities, but systems, health systems that value things a very different way. That difficulty is not going to be just with the work, but it's also going to be within the systems that we find ourselves working within. And then thirdly, at the National Collaborating Center for Determinants of Health, and I think Rebecca in our small group mentioned our podcast on Mind the Disruption. And we found that telling the stories of people who actually can see a better world, are not willing to tolerate the status quo, that actually want to move forward and are willing to raise up their stories. So I think there's 13 or 14 episodes. I'm sure there's folks around this table that might want to tell their story or tap someone else. But I find those inspiring. I find those to be liberating, if you will, where you actually can hear someone else effort, both at that local, but also at the system and at the global level. So Mind the Disruption is the podcast. If you want to contribute to it, we're open to that, but please have a listen to that as we try to lift story as evidence and story of actual action that has resulted in difference and change. So I'll stop there, Trevor, and thanks, Shannon, for the opportunity.
Thank you. I don't see any other hands up, so I'll just very quickly share something.
Sorry, we were going to go to Val from the Healthy Public Policy as well, if we could.
I'm sorry.
Yep. Thanks.
Hi, everyone. Thanks, Shannon. I won't take too much time and kind of build a little bit on what Claire was suggesting. I really loved your presentation, Lindsay. And I think that you point out really the things that are the sort of key challenges. But I want to focus in and rather than give you my perspective, ask you one of those hard questions that we can think about, or ask anyone who wants to jump in. And that is it possible, I'll be as provocative as I can be. Is it possible to think of a well-being society policy at we usually refer to it in our work as the central government, or in the case of Canada, the federal government? It could be a provincial government as well, but is it possible for us to create policies like that, like the one you mentioned in Wales and New Zealand, in Finland, in Scotland, all of these examples that we have? Can we have those policies that, as they go through their iterations and become adopted, do tend to water down the more challenging aspects of how we see well-being, and especially the one that questions the primacy of the capitalist economic system and that points out power differentials in society? Someone put in the comments the famous Stephen Harper reaction to the Missing and Murdered Indigenous Women and Girls report as "now is not the time to engage in sociology," which, as someone who has their background in sociology, it was a very treasured insult. It's always the time to engage in sociology. But I really do wonder, and my context, as you know, over the last several years is in working in an interdisciplinary approach to well-being policies, well-being economies. And there is pushback against questioning the primacy of the status quo in many ways, of the economic system that we have. And so the dilemma that I have, and I agree with everything in the piece that you presented, but many of us are in the context where we work for governments, we work in government organizations, we're funded by governments, and we cooperate with different policy-making actors and at different levels. So can we do well-being policy if it has to be watered down at different levels? Is Canada's quality of life strategy, for example, is it a well-being policy? Is it useful, or does it in fact set us back from what we really want to do in public health?
Yeah, thank you, Val. I have so many thoughts, I can't even keep them straight on my notes page here. With respect to the question of can we have like genuinely well-being oriented policy, I think we have, and that's my sort of optimism of the will speaking there, but it's really, really hard. And so one initiative that I've been involved in to kind of try to think this through is the Canadian Centre for Policy Alternatives flagship initiative, their alternative federal budget. So I sort of am the pen, so to speak, for the chapter on health equity. And so the alternative federal budget, for those who don't know, it's kind of self-explanatory, but it's a what if exercise. It's like, what if we designed a federal budget that was in the interest of the public instead of a privileged minority? And so it's really, really hard. And I stretch my thinking every single year. And I love it for exactly that reason. So do I know exactly what that would look like? No, but I think we have some good ideas. And others on the call, like Rebecca Sheff, are involved in that process as well. So I think carving out space to actually sit down and try to think that through is a big part of it. And that happens to be one where I have kind of tried to carve out that space for myself. The kind of depoliticizing, sanitizing, watering down is also such an important question. So for example, I think I can say this, Val, because you and I have had this conversation. So I've been disappointed that some of the federal work in the public health context, which I believe started as being about the well-being economy, has now become about well-being. So it's actually dropped the word economy, which to me is just it drops the entire value and power of the concept. So that is a big problem. I don't think that's going to be transformative in any way. But if we think about the public health community as a collective where people have different platforms, different spaces, different abilities to speak out, we could kind of sort that out amongst ourselves, right? So myself as an academic and as a tenured academic, like I can speak out, so I can be a voice, and others of us can be voices as well, so that as a community, we're making sure that this kind of discourse doesn't get lost and it stays at the forefront, right? So I think of that quote where I won't get it exactly right, but democracy is always a struggle. It's never a given. It's always a struggle. And so the types of things we're talking about here are likewise. We always have to be fighting for them, and we have to find ways as a community to make sure that we are speaking out, even if certain people can't. I think that was most of my points.
Thank you for this, but we need to move on into the small group discussions at this point. So taking all of that as background, what I want to do now is to move us into small group discussions. So you've already seen that we're going to break you up into 8 groups to discuss issues that come out of both the Geneva Charter for Wellbeing and our theme paper, background paper for this Summer Institute. And these have already been mentioned by Lindsay, so I won't go into them again. But these are the 8 topics, and you'll find yourself in one of those. What we want you to do in that, each topic has an expert facilitator, and they will introduce themselves, and they will provoke discussion on this question, which is, what are some of the implications of this action area? For example, healthy public policy. What are some of the implications of the concept of healthy public policy for our society, for our community, and for public health practice? So that discussion we just had about how do you actually do this in the face of the dominant paradigm? And so the expert facilitators will provoke this discussion. Again, we're not going to have a report back per se because we want you to have the time for discussion, but there will be a Miro board which will enable you to keep records and record your comments and thoughts, and we will be creating an Institute report later that will share that. So in order to get us to that, I'm going to ask Rebecca and then to talk briefly about using Miro, and then we're going to get Christina to talk about the process of getting into groups. So I'd better release this and turn it over to Rebecca.
Great, thank you, Trevor. My name is Rebecca. I'm the PMO and Quality Assurance Manager at PHABC, and I also am familiar with Miro, so thought it would be helpful to give everybody a short little tutorial on how to use it. Basically, it's an online digital whiteboard where you can write on sticky notes, and it's a great way to capture everybody's ideas. So I'm just going to pop the link into the chat first. So you can find it in the chat. You might be prompted to enter your email address, but just skip that part. Just go straight to the board, because if you do, then it'll bring you down this path of trying to get you to sign up for an account, which is free, but you just want to skip that part because it's not needed. So if you want to just click the link in the chat, open it up on your browser, and don't put your email in, just move to the board. And I will provide a little tutorial once everybody has that open. All right. So once you have it open on your browser, you should see this screen. I'm sharing my screen now, so if you come back to Zoom, you'll see a board. What are the implications of a well-being society? And there's several different questions based on whichever breakout group you go into. So I'll show a little video first on how to use Miro, and then I'll kind of go back to the board and demonstrate some of that. So I'll just play this now. Okay, well, I can just show you. It's pretty easy. I'll just do the tutorial myself. So if you go onto the board here, there's a couple different ways that you can pan around. So if you're using a laptop, then you can use the trackpad on the laptop to just move forward and back on the trackpad, up and down, and pinch in the trackpad to zoom in and out to your appropriate question for your breakout group. There's another way to zoom in and out. You can go on the bottom right corner here and click zoom in or zoom out. The other way that you can move around the board, and this is especially important for people who are using a mouse or using a desktop computer, then you would right click and drag. So if you right click on the screen and then drag, this little hand will pop up and you can move back and forth. Another way to do that is actually hold down the space bar. So if you hold down the space bar and then click and drag, then you can also pan around the board. So once you navigate to your question, you can see here that there's some sticky notes. So you can grab the sticky note and you can move it anywhere on the board and then double click, and it'll give you the option to type here, and there you go. And you can continue to zoom in closer to the sticky note if you need to see it clearer, and have the font bigger, and then you can zoom back out to see everybody else's sticky notes. And you will have, as Trevor mentioned, you'll have an expert facilitator in there, and then you'll also have somebody who is a Miro facilitator to just be on the back end and provide some tech support. Another option, if anybody is having trouble actually accessing the Miro board, you can also pop your answers into the Zoom chat once you're in your breakout groups. And then that tech support person will copy and paste what you've put in the Zoom chat and put it onto a sticky note on Miro to make sure that it's captured. So that's a little bit about it. The other thing I wanted to mention that you can turn on or off is if you go into the top right corner here, you can see that there's a little option about show cursors. So if I turn it on, you can see all the cursors moving around the board, which is fun. It's exciting to see all the action happening. But if that is distracting to you, you can go and turn that feature off. Then you'll have some peace on the board and be able to focus a little bit better. So up to you what you'd like to do there. And I think that's everything. Does anybody have any questions about Miro as we're getting in? Was everyone able to access it okay?
And you will have a PHABC facilitator in the room too. I think we should get people into groups.
Yeah, no problem. So everyone, I'm going to be sharing the 8 different themes that we're going to have for the breakout rooms. I just shared it in the chat. We're going to be opening the breakout rooms. You can choose which room you are attending. But please note that we have a maximum of about 11 or 12 people per breakout room. So if you go into a breakout room and there's too many, please choose your second choice and go into there. We will also monitor the breakout room, and if there's too many people in one room and not enough in another, we will automatically move a few people. We ask for your patience and while we do that. And yes, as Rebecca said, there will be a PHABC support person in the room. If you're not able to access Miro board, you can put your comment in the chat and the PHABC facilitator support will copy that over to Miro board so we make sure we capture it. Kelsey, we can open it up. And yeah, if you have any trouble getting into the breakout rooms, you can also just let me know which one you want to go into and we can manually move you in there as well. So if anybody's having any tech issues, we're here to support.
Thanks, everyone.
So far, healthy public policy and digital transformation are our most popular ones. So just a note on that. If you guys want to get in there now.
I'm sorry, I think I might need tech support. What am I supposed to write down when it says tell us about your team?
But there shouldn't be that. We're just right now at this point, you just want to go into a breakout room. So if you scroll to the bottom of your Zoom menu, there should be a box called breakout rooms. Or if not, if you click on there under the more, you should see a breakout room box. If you open that, it'll give you a selection of 8 different rooms to enter into.
Sorry, thank you.
No problem.
I see it now, thank you.
Healthy public policy is full, so nobody please attend healthy public policy. And if any other people join in, we will be removing you. I apologize for that, but it's just got a little bit popular. And yeah, if anybody's having trouble getting into the rooms, let us know. I will move you into the room myself. Digital transformation is getting full too, as well as expanded ideas of equity. So
it's Brenda. It's Brenda. I'm having difficulty getting into the room.
Okay.
And I wanted to join the governance one if that's possible.
Governance. Yeah, I'll throw you in there right now.
Thanks.
You should just be able to accept it now that I've moved you there. Hey, anybody else having trouble getting into a session, please let me know and I will assign you.
I was having trouble as well. You could throw me in the governance one too. It doesn't matter where I go, really.
Okay, all right. I will put you into governance. And just a note that that one is now full. So please, no one attend that one. Indigenous ways, health sector, equitable economy, value, respect, and nurture planet Earth are all have room. So please join one of those. And yeah, if you cannot join, please let me know and I will move you into one.
Hi, Christina. Are you able to put me in public policy? Is that open?
That one is closed. We have the maximum there.
Good.
I could do equitable economy, health sector, value, respect, and nurture planet Earth, or indigenous ways.
Health sector, please.
All right, I'll move you in there. Should be able to just accept it. Hey, Gina, we're moving you into value and respect. Oh, Sama, you are on mute.
So sorry. I wanted to ask, is it possible that I go to Indigenous Health?
Yeah, for sure. I'll put you in
Thanks.
there right now. Anybody else need to go into a room? I can move you in.
Hi, Christina.
Hi.
Sorry, I had to step away for a second. Which are the open ones still?
Equitable economy, health sector, and indigenous ways, and value, respect, and nurture planet Earth.
How about you put me in whichever has the fewest people? Happy to.
Sounds good. I'll move you into equitable economy. Okay, we're all jumped back in here. We had nobody coming in early when we put the 2-minute warning, which means that you guys were having some excellent conversations in the breakout rooms. I can't wait to hear more about it. I'll pass it back to Trevor and Lindsay if they want to say anything before we take our lunch break.
I don't think so at this point. I don't want to keep people from their lunch. Thank you. The group that I was in on healthy public policy had a great discussion. Those Miro boards are actually still active, I think, so you can still be using them if you want to add thoughts as you go along. We will be taking all the information from that and, again, building it into some sort of a report. What I was encouraging our group to do, and the other groups, if you get time over lunch, although you should really go outdoors and enjoy the weather, but if you want to spend some time on the computer, just maybe clustering some of the ideas would be useful so that we can see what relates to what, if that would be something you're able to do. But we will certainly be using those boards for creating a report back. Not straight away, I don't think, although I suppose we could probably do a screenshot of each board, I assume, Christina, and just send it out to people after the Institute. so that you get feedback straight away. Oh, hi, Courtney. There you are.
Yeah, we're happy to do that, to send out screen shots. We also have the Miro board open for an additional, I believe, 7 days after this. So if anything comes up over the next couple days and you guys want to add to the Miro board, that link that we provided, which I just shared in the chat again, and I'll do it again, you can go back to that board and add in additional thoughts. And yeah, it will be closing exactly a week from now. So that would be July 2nd. So yeah.
Perfect. You could spend Canada Day playing with the Miro board. There you go.
Exactly. There you go. Perfect. It's
Paul,
perfect
nice to see
evidence to
you.
some people.
Paul, you got your hand up. Nice to see you. Thank you for doing this.
Just thinking about, and how to collate information. We had Pael doing the Miro board facilitation in my group, which was the intergenerational equity and interspecies equity. I think for those at the PHABC, if you could also, if there's a way to retain the chat from the small groups and think about integrating that in your note taking. And I know that Pael is also having a Word doc. I'm not sure we've mastered our synthesis in the Miro board in our group yet. So I hear you inviting people over the next 7 days to do that. I have some skepticism that actually happens a lot. So I'm definitely wanting to grant some synthesis opportunity and responsibility to the PHABC team and to take these insights and further flesh out what is a fabulous think piece. Well done.
Thank you. And yes, we let me just check back in with Christina and Kelsey. But as far as I know, we will be capturing all of the chats from all of the breakout groups as well as the main plenary one.
We should be able to capture the chats, and I know some of the chats have gone onto the Miro board, so we'll capture everything we can with that, as well as we have our PHABC support staff in the room. We're supporting that, so we should be able to get all the information. And yeah, we do usually have some people that go on to the Miro board afterwards and put in their thoughts. We've had some success with that from before, so we encourage people to do so. If you
Well
get the
done,
chance.
people. I will endeavor to join that impressive group.
Well, and I just want to say that the synthesis is everything. And so we're really committed to that. And there were a lot of resource links also throughout the day's conversation and reference points. So that'll all be in a chapter at the end of our Institute report where people can follow up resources that have been recommended by partners and colleagues. I'm really excited. Like every room I've been in has just been unbelievably effective in terms of the quality of the discussion. So really exciting for us, and we don't want to lose any part of it. Much more to come from this, including future webinars, etc. But for now, what a great morning. Thank you so much, everybody.
And so with that, enjoy lunch. I guess you'll stop the recording. We don't need to record an hour of blank space.
And I love seeing Diane. Diane, our partner in Prince Rupert. Hello. She has to sign off. Bummer. Okay. I missed chance saying hello.
Shannon, I just wanted to once again praise the staff for incredible work organizing this so far. I know I had to miss the 11 to now, but the morning was amazing. And Kelsey, I took advantage of the recordings of the pre-institute meetings for the facilitators. Very, very helpful and just above and beyond in terms of preparation and organization. So once again, kudos to everyone, you included, Shannon.
Oh, well, they're brilliant. And I try to stay out of the technical stuff because they know what they're doing and I don't. I can barely get it posted on a Miro board, but yeah, I'm the person that tries to have plan A, plan B, plan C because I am so inadequate. So it does serve a purpose. But anyway, what a great morning. And we had a really useful conversation briefly at lunchtime about some next steps for this coalition that we're storming.
And I'm just about to start talking about it.
Great. Let's go, Trevor.
Well, where are we? We haven't had the obligatory 5 minutes, but this isn't a fully academic audience, so maybe we'll cut that in half and do 3 minutes. And I just sent you a note and an email.
Maybe if anybody has any thoughts about this morning or one word you want to put in the chat about how you feel about this morning, that would be helpful to us as a little mini check-in.
Yay would about express it for me.
I would think this meeting reflects the tension between the biosphere and the technosphere.
Meaning you didn't have a long enough lunch break? For those who don't know, Doug Cordemage, who I'm just going back and forth with, is a pediatric plastic surgeon at the Children's Hospital in Vancouver and a leader of Doctors for Planetary Health, and worth a shout out.
I just reflect on loyalty because I feel like there's so many loyal colleagues and partners that keep showing up. And it just means everything to us to know that we can count on you, that you're in the same space doing the heavy lifting. And we really are so grateful. So my one word expressed in a paragraph of speaking is loyalty. Thank you.
It was ever thus.
I'm Irish. What can I say?
Okay, folks, I am going to take us into the afternoon. I've got about a 20-minute presentation, and then we're going to go into the World Cafe, which is a bit of an experiment in some ways for doing a World Cafe virtually online with 100 or so people. But we have faith in your ability as well as the ability of our staff who are behind all this, as was just noted by Simon, and they've done a great job, and we're very grateful. So I am going to just share my screen, if I can find it. That should be it, and take us into the afternoon. Okay. So what my task is this afternoon is to try and make some connection to what it really means to actually do this as part of public health practice and wider health system practice and wider societal practice, which is what you'll be talking about in the World Cafe. I just want to remind us, as we said at the outset, that this is what a well-being society is. It is one that is committed to achieving equitable health now and for future generations without breaching ecological limits. And I just want to share this because I think it relates to some of the conversation in my small groups and also to what Lindsay was saying earlier. I find this a sort of dominant theme in all of my work. It's actually from the Worldwide Fund for Nature, from their Living Planet report, which if you don't see it, you should. It comes out every 2 years. And back a decade or so ago, they wrote this: ecosystems sustain societies that create economies. It does not work the other way around. And so much of the time we try and make it work the other way around. And so that little model on the right expresses it very beautifully. And you can talk about it in all sorts of ways in terms of, for example, I did a whole series of columns about the values that underpin this, the values that underpin our relationship with nature, our relationships with each other, and where the economy fits into all of that. So there's a lot you can play with that. But that, for me, is that's the message we want to get across, for example, to the Cabinet Committee and the government, for that matter. So these are things that were reflected in the previous sessions, because we had sessions on all of these, but also they came out of our theme paper that we wrote for this. Some key principles are to make the well-being of all people and all living things on the planet the central focus and purpose of society. That means that because it's about the well-being of all, it means this is about equity, including social and environmental justice. And it also extends that principle of equity to future generations. And it must all be achieved within the Earth's planetary boundaries. And this requires us to reimagine a system and process of governance. I commented in our Healthy Public Policy session that we basically live in a world of 18th or 19th century government with a bunch of silos that do some piece of public policy and don't really talk to each other. Where we actually live in is a complex adaptive system called a society, which is within a bunch of complex adaptive systems called ecosystems. We need a complex adaptive system of governance, and we don't currently have that. So that's the reimagining I'm talking about. It's at a very profound level, the implications for both governance and government. So one way we're doing that is starting about 3 years ago, when a group of us got together and wrote an open letter to Canada's First Ministers on the theme of World Health Day that year, which was Our Planet, Our Health. And we got, as you may well imagine, zero response from them. But that we went on from that to eventually form what is now called the Canadian Coalition for Planetary Health and a Wellbeing Society, which fuses these notions of well-being and the notion of planetary boundaries and planetary health. You see here our vision and our mission, and I'm the interim convener of this, and a number of the people on this call are part of the coalition. And in fact, the Public Health Association of BC, thanks to Shannon and to Becky Meyer, provides the sort of infrastructure the small infrastructure we need to make this happen. So PHABC is very much part of this coalition, as is the Canadian Public Health Association and a number of other currently 21 national organizations. So we have 21 national and provincial health sector organizations, 50 or more engaged individuals, and all of that is expanding. It includes PHA and PHABC, CPHA rather, and PHABC. And as I just said, PHABC provides logistical support, for which we are very grateful. Our letter to the First Ministers 3 years ago, which was signed on to by 38 national organizations, including the ones you see here, so the Canadian Medical, Nursing and Public Health Associations, CAPE and CANE, which is Canadian Association of Nurses for the Environment, and so on. We asked for three things. The first was to coordinate a healthy approach to society centered on well-being and interconnection within nature, a well-being society, in other words. And so we suggested that there should be a well-being society office in the Privy Council office. The recent announcement of a cabinet committee on quality of life and well-being isn't quite that, but it's a step in that direction, and similar structures in the cabinet offices provincially and territorially. We also suggested that Canada and the provinces should each adopt a Wellbeing of Future Generations Act, as they've done in Wales a decade ago, and it works, and we should go there. And that also leads to the creation of a Wellbeing Society Commissioner who stands outside of government. And so the beauty of that is the Act and the Commissioner means that this should survive a change in government, because it's a bit like the Auditor General in terms of its role. Doesn't report to the government, reports to Parliament. That's the idea. The second thing we asked for was a transition toward a well-being focus for Canada's economy. And at that time, the Department of Finance was working on a quality of life framework for the Canadian government and policy making. We want them to do that and to define success beyond GDP. And we want them to reduce GDP reporting to twice a year and replace it with other reporting on quality of life metrics. Ongoing concerns, things we're going to take to the Cabinet Committee on Quality of Life and Wellbeing. And the third theme was to build a sustainable health system that is, if you like, a well-being health system that helps both people and the planet. So we want a national secretariat to support that work. We still don't have that. We want to escalate Canada's commitment, and not just the Canada's, but we have to get the provinces to sign on to WHO commitments to resilient low-carbon health systems. The Canada can't commit the provinces, so we need each province to sign on to the WHO commitments to low-carbon health systems and so on. So those were the three things we asked for at that time. Since then, this is what the coalition is now doing. And I should have said, I think I touched on it earlier, but I want to be clear that our mission as a coalition is to mobilize the health sector in support of a well-being society. So there's lots of other groups working on the idea of a well-being society or a well-being economy. We want to join with them, and we want to bring the health sector into that discussion, the whole health sector. So our focus is on how do we mobilize the health sector in support of a well-being society. We've just sent a letter to the Cabinet Committee on Wellbeing in conjunction with Courtney Howard, who was running the health sector session earlier today. And she's got an organization she's setting up called Power, based on Generation Squeeze, and we had Paul Kershaw also today. So she's setting up something called Power to try and coordinate an academic and research voice and communications and policy advocacy around well-being. We're talking about things such as a policy brief, a communications strategy, and so on. And I would just flag that WHO in 2023 brought out what it called a global framework for integrating well-being into public health. It's actually broader than public health, into governance. I would also point out, and I mentioned this, I think, earlier in our discussion, it was in the offline discussion, I think, the Prime Minister, the new Prime Minister, Mark Carney, has given a mandate letter, not to ministry by ministry, but to Cabinet as a whole. And it has 7 priorities. Not one of those priorities is environment. And in fact, the word environment doesn't even crop up in his mandate letter, which is very troubling. There's only a passing reference to climate change, a kind of kiss-off thing that says, we will fight climate change. That's literally what it says. End of discussion on climate change. And there's no mention of quality of life or well-being, even though they've just set up this new cabinet committee on that. So all of that says we have a lot of work to do, but we do have in that cabinet committee and in other places a chance to focus some of that work. And part of our discussion over lunch was about setting up a sort of national network to work on influencing the cabinet committee and through them the cabinet on these issues federally. We're going to need to create a similar thing provincially. The other things that we are talking about, I've mentioned this already, the idea of a People's Commission for a Wellbeing Society. We have a working group on research that is campaigning primarily for CIHR to create an institute on environments and health. We don't have one, which is kind of ridiculous, 25 years into the life of CIHR. And we also want a transdisciplinary research funding body, because you can't create a well-being society or a well-being society research agenda in silos. It's got to be holistic, transdisciplinary, systems type research. And then I've mentioned already POWER, the group that Courtney is bringing together and bringing up. And then we have a working group on education that is carrying on the work of the Ecological Determinants group on education from a decade ago, and very interested in the Association of Faculties of Medicine of Canada have a planetary health roadmap that is relevant. Some BC implications, things we might do. Should we create a BC coalition for planetary health and a wellbeing society? I think we should. And we should push locally for a Wellbeing of Future Generations Act, a Wellbeing Society Cabinet Committee or office, and a wellbeing budget based on a quality of life framework. And there are things such as a Wellbeing Economy Policy Design Guide from the Wellbeing Economy Alliance, so we have resources to make that happen. And of course, the work that Lindsay does with the Canadian Centre for Policy Alternatives and the alternative budget there. We need a commitment to a society living within planetary boundaries, which this current government doesn't seem to have. We still don't have a Species at Risk Act in BC. The Biodiversity and Ecosystem Health Framework that was created under the last government as a draft seems to have disappeared, but is a great model to build on. And I would just point to an interesting resolution from the Assembly of First Nations Chiefs in Assembly back in October that called for the legal recognition of the rights of and personhood of nature within unceded traditional territory, and for all levels of government to work in partnership with First Nations to legally recognize and protect the rights of nature. That's very much something we need to get behind. And of course, on the health system end, BC should make its own commitment to the WHO Resilient Net Zero Carbon Health System Initiative. And then at a local level, here are some of the implications of all of this. First off, all of the national and BC suggestions that we've made so far can be applied locally. And one part of the discussion in our Healthy Public Policy group before lunch was that in many ways, healthy public policy may be easier to do locally, municipally that is, than provincially and nationally. So taking these ideas to the local level, tailoring them appropriately to the local level. So that means we have to get to what some of us call a one planet Canada. That is to say, a Canada with an ecological footprint of equivalent to one planet. Currently, it's 5 planets. So to get to one planet means an 80% reduction in our ecological footprint, and that applies at all levels from the local to the national. Now, 2/3 of it is carbon, so if we can deal with the carbon footprint, we're most of the way there. And at the same time, you have to meet basic needs and ensure high levels of human and social development. So this is local level well-being communities, if you like. And we have some examples. It was already mentioned that Nanaimo has adopted donut economics as the sort of planning framework for building its thriving, sustainable and equitable community. In Vancouver, the Vancouver Economic Commission published a report a couple of years ago on a proposed new framework for measuring Vancouver's economy that takes it beyond GDP. Here in Saanich, where I live, One Planet Saanich, which has been going for about a decade, or not quite that, 7 years now, as part of a global project, it has spawned, in fact, the creation of One Planet Planet Living BC, which is really talking our language, a happier, healthier lives for everyone within the limits of our one planet. And One Planet BC, and there's the link to it, helps communities across the province understand sustainability priorities. This started, as I say, with One Planet Saanich in 2018 as part of a global project. There is also linked into both of these initiatives the Centre for Eco-Cities at BCIT, which is doing some world-leading work. It's the world's first centre for eco-cities. And all of that is based around Bioregional's 10 principles of One Planet Living. And I would just draw your attention to the fact that the very first principle is health and happiness. So the principle of One Planet Living and this comes from Bioregional, a UK-based non-profit. So this begins with One Planet Living, begins with health and happiness. Notice it also includes both equity and local economy, and it also includes culture and community. So it isn't just about food and transport and energy and all the usual suspects of sustainability, but these things as well, and integrates them. So this may be a useful model or framework, or the Nanaimo model, or the Vancouver model, or any of the others that are out there trying to achieve the same thing. If you look at Saanich's ecological footprint from 4 years ago, this is based on household expenditure. The big blob there on the left is the 46% that is senior government impacts. But the rest of it, notice how big food is as part of our ecological footprint. 24%. The next biggest transportation is 17%. And then you've got buildings at 7%, mainly energy and construction materials, and consumables and waste at 6%. So these are the big areas where we can focus activity. These are the senior government impacts. I won't go into them for the interest of time, but what we need to be looking at is, and talking about, and I hope you will address this in part in the session that is to come, what are the health co-benefits of a One Planet region? We can talk about the health co-benefits of a clean energy system, whether it's industry or transportation or space heating or electricity generation. Get a clean energy system and you reduce not only climate change, but air pollution. The health benefits of a low-meat diet and of smaller portions. Following the Canada Food Guide, basically, is the message here. Active and public transportation, lots of benefits of that, including strengthened social connections, and so on. So be thinking about what are the health co-benefits of sustainability, or conversely, what are the sustainability benefits of healthy living? Either way works. And obviously reducing pollution and waste is a health co-benefit, has health co-benefits. So those are just some framing ideas as you go into your next conversation in the World Cafe about what you can do as public health practitioners, as citizens, who you need to work with, and what we can begin with. And that's what we hope you will spend the next hour and a half or so discussing. Lindsay, I'm turning it over to you to talk about the World Cafe.
Great. Thank you, Trevor. That really sets the stage perfectly. So this next and final interactive activity is a virtual World Cafe. And this is a chance to explore and share ideas on what this all means for you as a practitioner and as a citizen. Each of you will choose 4 rooms in total and virtually move from one to the next. Each room will focus on a particular topic or policy area and will have an expert facilitator. In these rooms, you will sequentially consider 4 questions, including building on what the group before you discussed. So the questions are, what does this mean for you as a public health practitioner? What is your role as a citizen? Who do you need to work with? And what can we do tomorrow? And you'll spend about 15 to 20 minutes in each room. And I will hand it over to, I believe, Christina for some further instructions. Thank you.
Thank you. So what I have done now is I have shared the different themes for each of the World Cafe sessions in the chat, as well as the link to Miro that you will be using to capture all of the discussion. And when we open the breakout rooms, you guys will be given the option to go into one of these rooms. Please note, we're going to try and keep the room limit to 6 to 7 people. So if you see that many people already in the room, please choose another one. So you will go into your first theme. The expert facilitator will be in the room to introduce themselves, and there will be a PHABC support staff who will copy the Miro link into the chat, as well as the question you will be focusing on. Then you'll have about 12 to 15 minutes to go through the question and answer it and use your Miro board. At any point in time, if you have any trouble with Miro board, you can also put your comments in the chat and the PHABC facilitator will copy it onto the Miro board. We will broadcast when there's only a couple minutes left for the first session. So facilitators, support facilitators, please note that. And when time is up, we will send another broadcast. PHABC support facilitators may have to interrupt the conversation to let everybody know to move rooms. So please excuse them for that. And then what will happen is we will keep the breakout rooms open, but you guys will shift into a new room. And to do that, on your Zoom menu, you will click the leave button. It's in the very bottom right corner and go back to the main room. And then you will click the breakout room button, which you'll either find on your menu or under the more button. And you will choose a second group to go into. Once you go into that second group, we're going to give you guys a couple of minutes to do this transition. Just, as we know, this is a little bit of a test for us doing this. So you'll go into the second one. The PHABC facilitator will put the second question and the Miro board link into the chat, and you will do your second question. And then at the end of that time, come back into the main group, choose your third theme, same process, then choose your fourth theme. At any point in time, if you have any trouble getting into a breakout room, please let me know, and we will put you into a breakout room. We'll also note if any ones are full. And then when we are doing the shift from one breakout room to another, if you have trouble getting out of your breakout room, we're going to keep an eye on it. And if we notice that you haven't moved, we will pull you back into the main room ourselves, and then we can put you into a new room. So, there will be tech support along the entire way to help you guys if you're not able to get in between breakout rooms. And as I said, we're testing out this whole situation, and we think it'll work. We got lots of support, but I just please ask for patience and grace while we do this. Are there any questions? Not seeing any questions. So Kelsey will open the breakout room. You guys can choose your topic, and as I said, if you have trouble getting into it, let me know and I will put you into one. I'll also keep an eye on and tell people which ones are full. All right, healthy food and agriculture is full. Please, no one else join that one. Core values shift is also getting full, so please, no one else join that one. So those two are off the board.
Could you add me to the local well-being economy?
Yep.
Thank you.
And we have Sama wants to go into the human and social connection. We got Elophalin into digital ecology. Anybody else want to go somewhere? Room.
Please add me to the human and social connection.
We have more than 9 people in that room, so we're gonna have to pull a couple of people out. But feel free, we'll keep an eye on that and we'll get you in that for the second question.
Sure. Governance, regenerative investment.
Perfect. We'll throw you in there right now.
Christina, could you please add me, I'm Shona, to restoring nature and biodiversity?
Could you add me to healthy built environment?
Yes, we should be able to.
Christina, could you please add me to biodiversity as well?
I think we should be able to. Do we have enough room? I believe so. And I think, Kelsey, we're going to have to move a couple people from human and social connection and put them into decent work.
Christina, for me, anywhere you're short, people.
Decent work or erosion of local democracy, either one would be great.
Erosion of local democracy. Thanks.
Okay, we'll put you in there. Thank you.
Christina, is the max 7 or 8?
Max is 6 or 7. So.
Oh, okay. And I joined transportation. It's got 6 in it.
Yep. Yeah, and then no one else.
You can just add me to any room with space, please.
Okay, awesome. So either decent work or erosion of local democracy. Kelsey will put you in one of those ones.
I think for the rest of the folks here, I think we'll just pop you into a room.
So any aha moments, anything that you maybe think differently about now or hadn't thought of before or are inspired by, we'll just open a bit of space now for that.
I'll just jump in and say, I see Pete's here from GenWell, and Pete, we didn't get a chance to meet you this morning, so maybe you could take a minute and just share with us for a second about the social connection work you're doing. 2 minutes.
Thank you, Shannon. That's very kind of you. Hi, everybody. I know I had a few groups there. I'm sorry I wasn't able to join in earlier this morning. My name is Pete Bombachi, and I am the CEO and founder of GenWell, which is Canada's human connection movement. And we've been on a mission since 2016 to educate and empower and catalyze Canadians around the importance of face-to-face social connection as a proactive step that we can all take for our health, our happiness, our longevity, and for the betterment of society. Ultimately, we've educated people on eating well, exercise, sleep, water, don't drink too much, and don't smoke. And as probably everybody here now knows, that the research tells us that our social connections have as or more of an impact on our health, happiness, and longevity than all the things that we've educated people on. And post-pandemic, most of us are not back yet to the social interactions, habits, and routines that make us happier and healthier. So join us at genwell.ca. We deliver programming. We have 5 campaigns that are population level campaigns that we want to inspire all Canadians to think about how they can be part of the solution to building a more connected Canada. So, Shannon, thank you so much for that opportunity.
Well, I appreciate that you showed up in the midst of a crazy schedule to join us in BC for this. And also, I see WHO just produced its first report and guideline on social connection. So I think that social well-being without social connection is a complete misnomer. So yeah, we're glad you could be with us, however briefly, and there'll be more follow-up, and hopefully we can do a webinar with you. So I'll pass it back to Trevor and Lindsay to carry us forward with the rest of the dialogue, but I didn't want us to overlook you, Pete. Bless you.
Okay, so any quick thoughts? I will share one from my session, which was on healthy energy policy, and Sharito came in and talked about energy inequity, and that led us into a discussion about what's known as energy poverty. And there's quite a lot of work done on energy poverty. I don't think we have done the job of looking at the health impacts of energy poverty. So we could certainly do that. But then in the next session, we had Sandra there, and it raised the whole issue of energy poverty and health inequity in First Nations, many of whom are working to oppose fossil fuel use and LNG expansion and so on. And at the same time, many of whom are doing really innovative, exciting things in renewable energy and clean energy. So how can we both help, and how can we also learn from First Nations about healthy energy policy? And one idea would be for HOC or PHABC or maybe some combination thereof, perhaps with PICS, Pacific Institute for Climate Solutions, perhaps with BC Sustainable Energy Association, and obviously with the First Nations and the Assembly of First Nations in BC or the First Nations chiefs, to create some safe space in communities for a discussion about healthy energy, particularly in those First Nations communities that are looking to grow LNG, because that way lies economic development. So that was a very interesting idea that came out of that, and definitely something we could do in the next 6 months. Simon.
Hi, Trevor. So our group talked about the erosion of local democracy, which I know is a topic near and dear to your own heart, having done so much work at that level. We started really talking about what people can do, public health practitioners, but it was kind of framed, I tried to help frame it, the difference between substantive democracy and procedural democracy. And I think at the local level in particular, the lack of engagement or the difficulty in getting citizens to engage en masse has a lot to do with the lack of substantive democracy. In other words, the lack of average people to have control over their own society and to actually have some sense that they have effectiveness in changing it, even though they might have the right to vote for elected representatives or show up to meetings and say something. And then we kind of moved towards, well, what can we do and who should we be working with? And definitely was agreed that public health in particular, but also as citizens, we could do better connecting to local citizen advocacy groups and sort of community organizing. Claire at the last session brought up the work that the NCCDH is doing around a webinar on community organizing, which I'm sure she can share with the main group. And in the end, we really concluded that public health, this goes back to Lindsay's presentation really, Trevor, public health has a political choice to make, and there's a politics of health that we cannot avoid. And if we want to revive and revitalize and nurture social justice and equity, it means we are, by doing that, choosing a particular type of politics. And if we don't commit to that, we can be in trouble. And I think often people who see themselves in public health, believe in those values, are reticent to commit to working with people that have a particular type of politics. And you don't have a choice, especially in this world right now, where these crises are so acute and urgent. We have to take that step off the fence and engage with the people who are doing the things that we believe are the right way to organize the world. So that's how I would summarize what we're talking about.
Thank you. Any other quick aha moments? Any sudden flashes of inspiration or insight?
Tina, do you want to share from Mars?
Sorry, Shannon, I think you're a much better summarizer.
She did an amazing job just summarizing it to the last group, so she's tired now. It's been a long day. And you're 3 hours or 4 hours ahead of us, are you not, in Boston? So God bless you for hanging in there. Well, we talked about a lot of influences in the digital space that are critical, both for democracy and for public health outcomes. We talked about the role of state as actor. We talked about commercial interests. We talked about opportunities for networking and organizing. We talked about right relationships being central to effective communication and to mitigate misinformation. We talked about the importance of arming our children, and I say arming in the sense of preparing them with digital literacy skills, with critical thinking skills, as a way to navigate this incredible universe that's unfolding for them. We talked about the importance of regulation on factors like AI, but we also talked a lot about what is healthy and what is healthy for us, and the importance of a digital pause, the importance of protecting our children and being mindful of the resources and screen time, of the relationships online. We talked about the significant importance of legislation for violence prevention and child exploitation and stalking, human trafficking. So it's a big, big topic. It's everything in the world in a digital environment, and how do we navigate it, manage it? Things that public health can do are policy steps, advocacy steps, promotion of positive pro-social norms, creating conditions and principles that strengthen the way that we communicate online, supporting mutual care online, and exploring and understanding what's happening with thinking and trends and opportunities that are occurring, and that we need a degree of surveillance in this space that we do not currently have. So I'll leave it at that. I know there were many people contributed to the discussion, and I would like to say that we're 10 years behind where we need to be. Thanks.
Okay, Pema, you've got 1 minute, and then we need to close because we need to be out of here in 4 minutes' time if we're going to be faithful to our 3 o'clock.
Sure. I was just going to say one of my aha moments from the day was really in a previous breakout group, we talked about different kinds of equity and expanding equity. And it was Paul Kirsch's group, and he talked about intergenerational equity, and we also talked about humans to natural systems and worlds. And one of the things that was kind of an aha moment for the group was talking about looking back and looking forward. So what's happened on these lands to what people and how people have experienced different forms of structural marginalization, and then looking forward to how we can protect helps us to expand our thinking about equity. That's all I want to say.
Thank you. Okay, well, thank you all so much. I am going to just share my screen and cover some last points. Lindsay, was there anything you wanted to say before I move into our final few slides?
I just wanted to say thanks so much to everyone for your openness to having these conversations, and a final huge last thanks to the PHABC staff who are amazing. Thank you.
Good. And for some reason, this is being a little slow to do full screen sharing, but I'm hoping it will sort itself out. So the first thing I want to do is huge thanks. Huge thanks to all of the facilitators who made this possible. Thank you for that, but you'll miss a couple of the slides that I've added. So huge thanks to all of the facilitators who made this possible. In particular, to I am going to need those slides back up because my PowerPoint just quit, but huge thanks to all of the facilitators. Huge thanks to the staff at PHABC, to Shannon for her inspiring leadership, but above all, huge thanks to Kelsey, who is the organizing force behind all of this and made it all possible. So Kelsey, thank you so much. Okay, so I just want to, in wrapping this up, remind us that this is just the first step in what will be a larger initiative. So this was the Summer Institute. We are going to do monthly webinars. We've also got, I think, a whole bunch of follow-up ideas once we sit down and digest the wealth of information and ideas and inspiration that we just got from all of you. And then we'll look to a national conference in 2026. Not national, provincial conference. Well, maybe national, who knows? We should talk about that, actually. Okay, could I have the next one? So just to remind us, we want to expand this to the rest of the health sector, create partnerships, perhaps create a BC Wellbeing Society coalition, or as Shannon said, maybe a Western Canada one. We don't know yet. We want to expand it beyond the health sector, look at maybe the idea of a provincial People's Commission for a Wellbeing Society, and certainly link it on to national and international work. Next, we want to, oh, my system opened up again for me, but anyway, and we want to remember this, that public health is a social science, and politics, or more broadly, how we organize our society, is but public health writ large. And with that, thank you to all of you. Special thanks also to Lindsay. It's been a pleasure for me to work with you, and we've done some interesting stuff yet again, and I look forward to the next adventure, whatever that may be.
And I just have to thank my co-chairs, in particular, Lindsay and Trevor. We can't let you go today without saying such a profound thank you, because you're always inspiring, you're always leading, and you're so deeply cooperative people with such a commitment to participatory practice. And that's how these institutes need to be conducted. And I think you brought us to a new level of engagement, especially with the World Cafe. And to say that, as Trevor said, it's just the beginning, but we see you as the mother and father of this dialogue for us. And we thank you immensely for your parental support.
And the World Cafe idea, I think, actually came from Lara, and we just picked it up and ran with it. Okay.
Yeah, she's brilliant.
Well, we are done, people. Thanks to all of you. I hope that this has given you some food for thought over the summer. And I hope you're going to go out and enjoy what's left of the day and stop staring at a screen. I'm certainly going to.
And to help us improve for future years, we have a quick evaluation survey we hope that many of you can complete. Put the link in the chat. We also have a QR code you can copy on here, and we'll be sharing it afterwards over email. So please help us improve this model for future years. Let us know how we did. And yeah, have a great end of your day, everyone.
Thanks,
Thank you
everybody.
all the best.
Thanks, everyone.
I think the PHABC team is going to stay on for a couple of minutes.
Yep, good idea.
Thank you. And Trevor, did you get your beer?
No, but I can get a low on my way. I'm going to grab a